So one condition that I might see in my nursing profession that has to do with the urinary system is kidney stones. So kidney stones is a deposit of either minerals or bile acids in concentrated urine, and sometimes the only symptom that somebody has to show that they have kidney stones is they'll have severe pain in the side of their abdomen. So one way to diagnose kidney stones is by taking a urine analysis test. So with the urine analysis test, the things that might come up abnormal would be the pH of the urine, and sometimes in some cases there might be blood in the urine as well. So some ways to treat a kidney stone would be just to drink a lot of water so you can pass the kidney stone, or in some cases where the stone is really big, sometimes you need to have surgery in order to get it removed. So another condition that I might see in my nursing profession is a UTI, or a urinary tract infection. So with a urinary tract infection, it's when the E. coli bacteria, which is normally found in your digestive system, begin to infect the bladder and the urethra. So some symptoms for a UTI would be pelvic pain, there might be blood when you urinate, it might be painful to urinate. So one way to diagnose a UTI is by taking a urine analysis test. And some things that might come up abnormal when you take the urine analysis test would be nitrate, leukocytes, pH, and then sometimes blood in some cases. So one way to treat a urinary tract infection is by drinking a lot of fluids and by taking antibiotics to kill the bacteria. Another condition that I might see in my nursing profession is polycystic kidney disease. So polycystic kidney disease is an inherited disease where clusters of cysts begin forming primarily on the kidneys, and some symptoms of this could be a swollen abdomen, high blood pressure, or back pain. And a way to diagnose this would be taking an ultrasound and looking at the kidneys itself. So some treatment of this would be getting medication to control blood pressure, pain relievers, and in some cases you might have to have a kidney transplant because normally people with this condition will go into kidney failure around the age of 60. Another condition that I might see in my nursing profession is prostate cancer. So prostate cancer is when the cell's DNA gets genetically mutated and then the cells continue dividing. And then what happens is those cells continue dividing while healthy cells start dying. So some symptoms of having prostate cancer would be difficulty urinating, blood in your semen, pelvic pain. So one way to diagnose having prostate cancer would be to have an ultrasound where the doctor would stick a small probe up the patient's rectum and then take pictures of it to get a good look at the prostate gland itself. And some ways to treat this would be using hormone therapy or radiation therapy, or in some cases having to remove the prostate altogether, which is called a radical prostatectomy. Another condition I might see in my nursing profession is an autoimmune disorder where a person produces anti-sperm antibodies which attack the patient's sperm cells. So one way this might develop is because somebody had an injury to their prostate, and once the blood and the sperm came in contact with each other, that set off an autoimmune response. So one way to treat this would be having the patient get medication that reduces their immune response, because it's going to be a lot harder for somebody to have a child if they have this disease.